Hi. All right. It's been 3 weeks after surgery. I'm going to have links in the description of this video on YouTube below this. I think right now it's below the video. Those links are going to be to some age-restricted videos because those are my scars from after surgery. So you have to click through to say that you're age 18 or whatever if you want to view those. But if you want to see my complications that I'm talking about in this video, that's where you can find them. And they're unlisted, so they're not like in my normal listing of videos. So you can find them in the description of this video on YouTube. All right, so that said, hi, I'm Sarah. I just had breast reduction surgery 3 weeks ago, and I'm a stage 4 metastatic HR positive cancer patient, meta-thriver. And the question here is, when do I go back on targeted therapy, which is Ibrance for me? Currently I'm still on Lupron, and I'm still on letrozole, which are keeping me in menopause and keeping my cancer starved of estrogen, which is what it feeds on. Okay, so now that we got that out of the way, in order for me to do a breast reduction surgery as part of my weight loss thing, and they found bone density issues in my neck, and so I had a breast reduction surgery. I was verging on like an E cup, and they were like down to my belly button almost, and now they're like a C cup, or I would say probably still a D cup. I don't think they took enough, but they're still pretty swollen. Anyway, so I went from all of that, and to do that, they took me off of my targeted therapy for cancer because that slows healing. And it doesn't, the half-life of this thing, I mean, I'm not blaming the Ibrance. The Ibrance is the brand that I take. I'll link all this information below. Ibrance is the brand of targeted therapy. It's an oral targeted therapy. It's a 3-week cycle. Anyway, I've been off of it now for 5 weeks, which is a big deal, okay? Because I have a very common, and again, this is not caused by the Ibrance. This I was warned about ahead of time. I have a T-scar, so that means from where I had nipples. I didn't do the nipple grafts because the nipple grafts were pretty intense. The nipple grafts would have made the healing time even more. And I thought, well, I don't know how long I want to be off of Ibrance, so let's we'll look at other options in a different video in the future. Okay. So I've been doing wound care, and if you do want to see the scars, they're still draining, but there's no drainage in the videos, and there's no blood, but there are open wounds still. So that means no Ibrance. All right. So no Ibrance means, very limited cancer treatment. And so I asked my oncologist, and she said, oh, ask the plastic surgeon. Well, I'm the first person they've ever had referred to them by oncology. I'm the first person not the first person but for breast reduction. And I'm the first stage 4 cancer patient in their 25 years of business that they've ever done, somebody actively in cancer therapy, that they've performed a breast reduction surgery. I'm also the third most they've ever taken in one surgery. Like in all their surgeries they've ever done, only 2 other people had more tissue taken than me. Okay, all right, so, okay, those are some differences. So I asked them, so when do I go back on Ibrance? And they say, well, what does Ibrance do? They don't know. What does Ibrance do? And I'm like, well, it's targeted therapy, and it slows healing, and it makes it so that infections can take a hold. Well, certainly not until the wounds are closed, they say. And I got a couple of, first I hear a couple of weeks, but it's been 3 weeks since my surgery, and it's still not closed because of this very common thing where you get these holes. And again, if you want to see those, I've got links below. they're not pretty. But if you're a doctor or if you've ever like worked in the medical field, that might be interesting to you. I don't know. Or if you're considering having the surgery. But keep in mind, that's not because of the Ibrance. The Ibrance has a shorter half-life. Anyway, I just got off the phone with the Ibrance, the people that ship my Ibrance every month when I'm on it. Because I've been off for 5 months, and they keep sending me texts like, well, oh, you alive? And finally, they don't know either. It's not in their database. I don't think anyone's ever done this before. Like a stage 4 cancer patient getting a breast reduction surgery. So we're making all these rules up as we go. But anyway, so I gave her permission to get in touch. I gave her permission to get in touch with my oncologist, my prescribing physician, which is my oncologist. And then they're going to get back to me as to when, how closed, like, do they need to be just not weeping anymore? Do these need to be scabbed over? Do they need to be scars? Like, how closed is closed before I start Ibrance again? That's the question that I'm waiting for the answer to. How's your day going? All right, that's the news, weather, and sports with me. In case you're wondering, I feel like I have very nice cleavage now. So thank you, Dr. Dubik. I'll leave your link below too. And then, yeah, that's it. I'll do it. Maybe I'll show you what products I'm using for wound care. I'm not going to show you those scars again. They're just those, again, those are unlisted videos. You can find them in the links below if you're interested, but otherwise, that's that. So, all right. Well, I hope you're having a great day. Please be kind to yourself and others. Love you lots. Bye.